Hello, Vincent Carroll speaking. This is tutorial number 41, blood pressure. Many people present to acupuncture with blood pressure, probably because they've been to their GP and they're on treatment and they don't particularly want to be on treatment, or else they've just discovered that blood pressure is something you have for life. So they're wondering, can the acupuncturist have something to offer? Difficulty with blood pressure is, of course, sometimes there are no symptoms with blood pressure. That's why it's often referred to as a silent killer. But let's first of all ask ourselves, what do we mean by blood pressure? Well, blood pressure is pressure in the blood. It's pressure that's experienced by the wall of the aorta, the principal artery of the body, when the left ventricle contracts. When the left ventricle contracts, that's the heartbeat. It occurs roughly once a second if the heart's beating at 60 times a minute, or slightly more than that. So when the heart beats, a bolus of blood, the content of the left ventricle, is pushed and pumped through the aortic valve into the aorta. And if the aorta expands to accept this bolus of blood, roughly once a second, then the pressure against the wall of the aorta is dissipated out. But just supposing if the aorta is a rigid tube, maybe it's infiltrated with cholesterol, or maybe because of mental emotional stress, it tends to be inflexible in expanding. And that's very common. When that happens, there's more pressure against the wall of the aorta, so blood pressure is higher, and that pressure is measured in millimeters of mercury. So pressure is often described as 120 millimeters of mercury over 80 millimeters of mercury, and mercury, of course, is the only metal that's found in nature in liquid form, so it tends to be very heavy. So therefore, when the heart beats, it's able to push portion of mercury up a glass tube 120 millimeters, and resting between beats, there's still enough pressure there to push mercury up a glass tube 80 millimeters high. So therefore, that's what we mean by 120 millimeters over 80 millimeters of mercury, and that's normal blood pressure. Now, of course, blood pressure varies hugely. In people who are athletes, the blood pressure will be less. As life goes on, blood pressure tends to go up. Not always, but it tends to creep up a bit. And there are reasons for that. Often there's more infiltration of cholesterol into the arteries, making the aorta, the principal artery, less flexible, less expansive to take up the pressure each time the heart beats. So that's what we mean by blood pressure. And of course, if the left ventricle beats into a blood pressure zone, into an area where the aorta does not expand, it's in effect beating into a bottleneck. So it'll be back pressure. So the ventricle has to beat stronger. And by beating stronger, the heart grows, the muscles grow, so the heart enlarges as it tries to beat against, or the left ventricle enlarges as it tries to beat against the pressure, pump against the pressure coming in the other direction, which is the inflexible aorta. So therefore the heart can enlarge, and an enlarged heart requires an extra blood supply for its own muscles, with all the inherent dangers there of outgrowing its blood supply, creating angina and creating heart attack. So there are serious issues with high blood pressure, but on top of that, the pressure is transmitted backways into the left ventricle, up through the mitral valve, into the left atria, up the pulmonary vein, into the lung itself. And there, the lung is basically a bag full of membrane. On one side of the membrane, there is air, and the other side of the membrane, there's blood seeking oxygen. And if there's enough back pressure coming up, the water portion of blood, that's to say the serum, will go across the membrane into the air side of the membrane, because on the membranes that are packed into the lung, there's an air side and a blood side. The air side contains air with oxygen, and the blood side contains blood seeking oxygen, and the oxygen molecules are snatched across the membrane. But if there's sufficient pressure coming up through the left ventricle, into the left atria, into the lung, the water portion of blood is pushed through the membrane as free fluid to clog up the lung with congestion, congestive cardiac failure. And that's why people are on diuretics. Just literally a few moments ago, I was talking to a patient of mine who has just been started on Central K, which is a diuretic. And the reason for that is, again, for what is described as left-sided heart failure, blood pressure causing an enlarged left ventricle, pushing pressure up into the lung, forcing the water portion of blood across the membrane. There's, of course, the cell portion of blood as well. White blood cells, red blood cells, they don't cross the membrane because they're simply too big. I often have the analogy, supposing if somebody had, for example, a sheet and put a lot of sand or gravel plus water in it and sort of hung it up on the line, see what happens. And what happens is, of course, the water portion leaks out, but the sand doesn't leak out through the sheet, simply because the fibres are too close together to allow the sand or gravel to leak out. It's a little bit like that, really, where the water portion leaks through the membrane in the lung, whereas the more bigger bits, the white blood cells and the red blood cells, don't. So that's what blood pressure is, and that's the problem caused by blood pressure from a Western medical point of view. From an acupuncture medical point of view, we're talking about yang rising. And yang can rise in many ways for many reasons. I mean, as yin goes down, yang is not held in place, so yang rises. And yin going down is often something that happens later in life for people, simply because what is yin? It's serenity and calmness and peacefulness and all of that. And perhaps as one gets a bit older, there's less and less of that. And therefore, as yin goes down, yang can rise, and it can rise chaotically. And sometimes it rises in a way that's very, very noticeable. For example, it can rise in the gallbladder channel, causing migraine headache. And sometimes headache is associated with blood pressure, but not necessarily. It's not that the headache causes the blood pressure or vice versa. They're two separate entities going side by side from an acupuncture point of view. There's the rising of yang in probably the gallbladder channel or maybe the Sanjja channel, creating the migraine type headache or the tinnitus. And of course, the yang can also rise in the stomach channel, creating temporomandibular joint pain or of course as well, sometimes grinding of your teeth, but that could be a livery thing as well, but trigeminal neuralgia as well on the front of the face, and various other manifestations of both, sort of where the greater yang channels cover. The front of the face generally is this area of the stomach. The side tends to be the area of the gallbladder, and of course a thin area at the back going right up over the head tends to be the urinary bladder, and yang can rise in all of that, creating a variety of signs and symptoms. But it can also rise without any sign or symptom, and here we're talking about blood pressure, simple blood pressure, nothing else. Usually I find is liver based. Liver creates a sense of entrapment, a sense of internal anger, the internalization of your anger, which is entrapment of course, and eventually it spills into some of the transport lines, which are the large yang channels. I mean, it may try to stagnate for a little while in the lower jaw, may invade the upper jaw, may invade the middle jaw, of course, and cause problems all there. Sometimes it doesn't, but one way or the other it can rise up. So, and often the person is completely and totally unaware of it rising up, because their default position might be one of entrapment, might be one of holding in, not wanting to rock the boat, not wanting to say something. For example, if somebody is in the presence of a volatile individual or an employer, for example, or something like that, or has an element of uncertainty or an over-dependency on somebody or an employer, whoever it might be, then that person might be inclined to bottle things in. And the yang can rise in a very obvious manner, as we've mentioned, with migraine or whatever, but the yang can also rise in a not so obvious way, and that often manifests as blood pressure, where there's a tendency, maybe the invasion of the upper jaw, where a person might have a tightness in their chest, an awareness of their chest, tight shoulders at the top of the upper jaw, of course, as well, and a disinclination to breathe in a deep and satisfying way, which of course undermines gathering chi as well, and prevents full value being got from the root of O7 chi, spleen chi, but that's another story. What is really happening from a blood pressure point of view is that the liver is in overdrive. Does this happen with other organs being in overdrive, such as the heart? I don't think so, because that's so expressive, and if you express yourself, you tend not to have blood pressure. So for example, the person that doesn't stagnate, the person whose yang rolls into the yang channels and powers up, that person will probably express themselves verbally, and they will be volatile type people. They'll be shouting and roaring, and from their point of view, they're doing nothing wrong. They don't see there being any problem whatsoever, but they are expressing themselves in a way that is releasing an awful lot of energy. So it's not stagnation. So they won't get blood pressure. Other people might listening to it, but they won't get blood pressure themselves, because they are dissipating it. And the same applies even from a Western medical point of view. The person is able to dissipate and express themselves very often doesn't have blood pressure either, because blood pressure is often associated with the stagnation, is often associated with the bottling in of things, with years of probably trying to navigate a difficult situation. So that sort of is blood pressure from a Western medical point of view. From an acupuncture medical point of view, very often, as I said, there are no signs or symptoms. So somebody comes with you, say with a history of blood pressure, and have been just diagnosed blood pressure from their GP. I would say 1 or 2 readings is not worth anything. You have to have probably a spread of at least 24 hours, like the Holter monitor that you get in the various pharmacies, for example, and it'll give half-hourly readings to give a broad scatter of what your blood pressure is likely to be, because 1 or 2 readings are meaningless. For example, there's the classic white coat syndrome, isn't there, where somebody sort of sees somebody coming with their stethoscope and a sphygmomanometer, and they immediately say, gosh, there's going to be, your blood pressure goes up, because people are worried that their blood pressure will go up. So readings of that are quite meaningless. And I love looking at these sort of Holter monitor devices and the readings that come from them, because sometimes you see something that's just beyond explanation. I mean, I had one gentleman coming to me, and his blood pressure initially, when he had the thing applied, was through the roof. It was like 180 over 110 or something like that, because of course he had the anticipation he has high blood pressure. Then he got, as the day progressed, he kind of forgot about it, and the blood pressure kind of dropped away down, maybe to a more normal 130 for him, a more normal 130 over 86 or something like that. He was quite an older man, so that probably is acceptable. But then I saw one reading in the middle of the night, and it was about 200 over 120, and I sort of said, well, what were you doing at 3:30 a.m. in the morning for that sort of blood pressure to rise? He said he honestly didn't know. As far as he knew, he was asleep. So in other words, you do get maverick readings. I suspect he might have rolled over on it, and maybe sort of when the blood pressure machine was activating, as it does every half hour, to get a reading, or else he had a very disturbed dream that he completely forgot about, but something occurred. So the moral of the story is 1 or 2 readings don't mean anything, and certainly if people take their own blood pressure, that can be more harmful than good. It's good to do it maybe once or twice a year, maybe put a monitor on, and then get a true idea of what the person's average blood pressure is, because blood pressure really can go up and down. But I wouldn't get over focused on actual figures and readings. Instead, I would more focus on the person's lifestyle, and I'd wonder what are the contributory factors, because that's something you can do by discussion. Whatever about needles, I mean, obviously pericardium 6 bilaterally would be a very good choice. Relax down, maybe yin tang is a wonderful point as well, but move the liver, pull the liver down, of course, that's very important, with all the spring points, liver 2, gallbladder 43, stomach number 44, so on and so forth. Move with liver 3, gallbladder 34 also, and that's very important in dragging yang down. But try to find out what's happening in their life, try to find out can any sort of adjustments be made in their life from both a Western and an acupuncture point of view to come to some sort of common sense conclusion as well. But if you are going to diagnose somebody or confirm somebody's diagnosis with blood pressure, you have to think in the long term over many readings, and you have to kind of look for evidence of the liver being in overdrive and the suppression of their emotion, allowing the blood pressure to rise up. But blood pressure comes down just as blood pressure goes up, and consider diet as well. I mean, anything that puts too much cholesterol in is going to make the arteries into a rigid tube, and common sense tells us that the more elastic tissues you have, the more elasticity there'll be, and the greater capacity the arteries will have for expanding to accommodate the bolus of blood each time the left ventricle contracts. So I would see it very much as a liver issue. I'd see it very much as moving and decreasing the liver, but I'd be very aware of blood pressure. It is the silent killer, and sometimes when a person least expects it, the blood pressure can get too strong. It'll find a weakness in an artery, perhaps on the brain, and it might burst through, causing a bleed on the brain, often with catastrophic results. So blood pressure, I would treat it very seriously. Thank you very much.